Hi guys, we are back with our second video. I hope you like the first video. Please do share it, subscribe it, and don't forget to ring a bell. So we thought about what do we want to come up with our second video, and we came up with the most common problem in urban scenario, and that's low back pain. Everyone, at least 80% of people at some time or the other experience this pain. It can be due to muscles, disc, ligament, joint, bone, anything, you name it, and the problems can be due to wrong posture, lifting something, due to bending down. It can be n number of reasons, injury, but there is only one solution for it, and that is strengthening your core muscles. That includes your lower back, abdominal, and pelvis. It's one of the most important reason that you will not experience the back pain. Apart from your medication and if required surgery or anything, exercise is something which will play a very important role. So without wasting the time, let's start with the exercise. So I have designed a 3-phase program: phase 1, phase 2, phase 3. Phase 1 is the basic exercise protocol. Phase 2 after 2 months, if you are okay, even after 1 month. And then after 2 months of phase 2, you go to phase 3 and continue doing the phase 3. Now phase 3 is something which is like, even if you do a strainful activity, the pain does not come back. So it is important to go from phase 1 to phase 3, but it is also important that your body should be ready for phase 3. So don't attempt phase 3 exercises when you are in phase 1. So remember, go phase 1, then go to phase 2, then go to phase 3. Best exercise is wall slide exercise. So when you stand against the wall, you can feel that there is a gap here. Your hand can slightly go in. Now what you do is stand against the wall and bend your knees to the point where your hand cannot go in, and you press against the wall. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax and come back. How many times you should do all these exercises? Phase 1, you decided. Okay, so how much ever your body is able to take it. If you are comfortable doing it 5 times, do it 5 times. If you're comfortable doing it 10 times, please do it 10 times. Okay, you decide how much time you. For the phase 2, I will tell you how many times we should repeat it. Okay, the next exercise is called SLR, or straight leg raise. So as the name suggests, straight leg raise, you have to just raise your leg straight. Make sure your knee doesn't bend, both the knees. If you feel pain while doing the exercises, you can even bend the other leg and raise the other leg. It all depends upon you. You should be comfortable doing it, that's important. But this leg will be straight, the knee won't bend. You will hold it again for 5 to 10 seconds. 1, 2, 3, 4, 5, and you relax. And for the first phase, you will alternate it. So one, this leg, then you go to the other leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And bring it down. Okay, so hold depends upon you, repetition again depends upon you. Third exercise, both the leg we bend, and you can feel a gap here in your back. You just press against your mat using your abdominal muscles, and the gap should go off. Okay, it's called pelvic tilt exercise. So this is the movement. Again, holding it for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. This is one exercise which you can do even during pain. Okay, this is only going to help you. It's called pelvic tilt exercise because I am tilting my pelvis. Next, your legs are together, heel together, knees together, and hands down. And this exercise is called bridging. Very important exercise. You raise your pelvis, you tighten your buttocks and hold there. Now very important is, you don't do this, you don't curve your back, you just raise it, tighten your buttocks and hold it there. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax and come back. Again take it up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax and come back. Okay, next we do spine stretch exercise. Both the hands to the side, both the legs are anyways together, and I take the leg to one side and look the head to the opposite shoulder and come back and then to the other side. And come back. Okay. Yeah, so this exercise particularly is very good for patients suffering from sciatica or piriformis syndrome. One leg up on the other and you bend the other leg. So there will be a stretch right from here till there. Okay. Hold that. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. When there is a stretch, I would like you to hold it for a longer period of time, preferably 20 seconds. You can do less repetition, so the repetition can be just 5, but holding time increases in all the stretches. Now we go on to hamstring stretch. Some of the people actually experience back pain due to hamstring stretch. So this is the way you do it. Hold it there for again 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. If you have TheraBand or maybe a dupatta, you can even use that to pull it towards you. Make sure your knee is straight. If you can't do it, you can bend the other leg and then do it. That's also fine. But preferably this leg should be straight. The other way to stretch the piriformis muscle is bring it towards your chest and opposite hand take it to the other side and look at the other hand. So again, hold the stretch for preferably 20 seconds and then release it. Similarly, do it on the other side. Then the other exercise is knee to chest. So you bring your knee towards the chest, hold it there, and you do it for the other leg as well. Then bilateral knee to chest, that means both the legs come towards your chest and you again hold it there. It's again very good exercise for people suffering from disc prolapse. Generally we avoid forward bending in the phase 1, but only one exercise is introduced for abdominals in the phase 1. So I look up, my neck doesn't bend down because then I may have neck pain. So I am looking up, my neck is straight, I come up with the help of my abdominals as much as possible. 1, 2, 3. So my hand is actually not supporting my neck, it's just touching it. Okay? And with the help of entirely by abdominals, I come up. Yeah. So these are the exercises in supine position. Now we will turn to prone position. So let's start the exercises in prone position. We keep our elbow bent next to our body and we can be in this pose for 3 minutes, 4 minutes, 5 minutes. Very, very good for disc prolapse patient or slip disc patient. It comes into the category of Mackenzie extension exercise. The next exercise, we take the hand down the shoulder, Bhujangasana or Cobra Pose. We try to go as up as possible. If you can't go full up, not a problem. Just go half, breathe in, go up, breathe out, come back. Breathe in, go up, breathe out, come back. As we did SLR in supine line, we will do prone line SLR, that is take one leg up. Make sure you don't turn the body. Your body is on the mat and you just take your hip up without bending the knee. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alternate hands and leg. If your right hand goes up, left leg goes up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All these extension exercises are very, very, very important. Then you can come to crawl position. Your hands separate, your legs separate. Breathe in, you go up, your back goes down. Breathe out, you go down, your back goes up. Cat and camel, you stretch in flexion, and you stretch in extension. Again, very good exercise, and this has to be coordinated along with your breath. At the end, please do try to lie down in the child pose. Your hands, take it away as much as possible. You are sitting in Vajrasana and try to take your head down. If you can't do that, you can actually keep 2 pillows and do this comfortably. It will stretch your spine completely. Apart from that, actually you can sit on a chair and try to touch your toe, but while sitting on the chair, I would not recommend in the first phase a complete bend down. So I hope you like these exercises. Please do like this video, subscribe it, and don't forget to ring the bell. We'll be back pretty soon. Bye.